It's a controversial topic. Do you stabilize a patient after the first event? If you're not in a high-risk category, most of us would not. But the patient you describe, a high school football player, male, under 20, contact sport, likelihood it's going to pop out again is almost 100%. And so I'll just have it's a long conversation in the office with the family about the likelihood this is going to continue to be an issue. There's a better than 50 to 60% chance if they go back and play that season, it'll pop out again. And there is some data that there's a little bit, a tiny penalty for having it pop out again in the short term. So slightly higher rate of chondral and more extensive labral issues, more likelihood that there's going to be a bone issue that needs to be addressed, some issues getting back range of motion and normal function in the shoulder if you don't do it, or if they pop out more than once. So I'll describe those issues to them. And also we address the issue of anxiety and, the whole trauma of having it pop out again. And many athletes will say, hey, look, this was so traumatic. This happened in the middle of the field. All my friends are watching me. It was awful. I don't want to try to go back and play if it's probably going to happen again. And they'll just choose to get it fixed. But it's not outside the standard of care if you've counseled them on those risks, in my opinion, to let them play through the season. If it's like their senior season or their junior year and they're getting a lot of looks from colleges, I think you could make a pretty good argument that the downside of having one or even two additional events is outweighed by the benefits of playing through the season. So I'll let them play in certain circumstances is the answer. And the criteria, the exact criteria for actually being able to play is as soon as they get range of motion and strength back. So as soon as they have that, I would let them play. There's no evidence that doing anything other is going to decrease or change recurrence rates if they're back playing. So as soon as they feel good enough to do it, they're confident, they've got full strength and motion, I let them go.